Welcome to our next episode of Coffee and Conversation, AI in Healthcare. I'm Michał Urbanowicz, a medical doctor and a senior marketing manager at Informatica. And today with me is Professor Dr. David Matusiewicz, one of Germany's best-known minds in digital health. David, you're a dean and institute director at FOM University and managing partner of the DXM Group. You are also a scientist, multi-founder, editor, author, keynote speaker, and healthcare moderator. And in your research, you're focusing on healthcare management and health economics. Happy to have you, David.
Thank you for having me.
Great. And taking your expertise, knowledge, and passion for digital health, would love to ask you questions in regards, especially to the digital health evolution or revolution in Germany. So continue on that. My first question to you would be, Germany has been actively embracing digitalization in various sectors, like including healthcare. From your perspective, how do you see the current state of digital transformation in the German healthcare system, and what role do you believe AI plays in this ongoing process?
Yeah, thank you very much for the question. I think Germany is quite late in the digitalization of the healthcare sector. Even a few years ago, there was a big study from the so-called Bertelsmann Association, and there we found out that during 17 countries in OECD, Germany is the number 16, so nearly the last one. So there is a big lack of digitalization until now. But on the other hand, we started, for example, with the app per prescription, a new model where we are the first country in the world where we can get a so-called DIGA. It's a digital intervention, a digital app per prescription at the normal doctor. So there is, on the one hand, a big gap. On the other hand, we have smart ideas. But if you sum it up, we are at quite the beginning of the digital transformation in the healthcare field.
Mm-hmm. I see, and especially the DIGA Act plays its role, and it was widely noticed around the world as a big news for all the digital health sector around the world. And continue on that, in the integration of AI in healthcare brings for both challenges and opportunities. In your experience, what are some of the key challenges that Germany faces in adopting and implementing AI solutions in healthcare? And what potential opportunities do you see for improving patient care and overall healthcare efficiency for the use of artificial intelligence?
Yeah, there are kind of challenges. One challenge is the normal doctor in Germany is quite 60 years old. So there are a lot of people which have begun their job in a very analogous time. So it's hard for them they see it as a challenge because they do not know. The other hand is the patients also are quite, we call it German angst. So the people always think, what is data security? What is the problem in this field, especially when you talk about AI, because they don't know it, they have no own experience. So on the one hand, there's a big challenge, but on the other hand, since ChatGPT and other tools, we see it in different branches and also the private area that the people use such tools. And we have, for example, Ada Health here in Germany from Berlin. They use, for example, in the diagnosis finding AI for years. And we know there are huge and nice solutions. And I think the younger people or the people which have more knowledge in this field, they use it already. But I think when you compare it to a mountain, we are at the beginning on the ground of the mountain, but we see a lot of interesting AI stuff coming to us, and it will improve from year to year, to my mind.
And to what potential opportunities do you see for improving patient care?
Yeah, we have, on the one hand, we have spent a lot of time with bureaucracy in Germany. About sort of 30 or 40% of the doctor's time or nurse's time is bureaucracy. And I see here we have a lot of problems getting new people in this field. So here we can have AI, for example, to close the gap between the need on the one hand and the people which are working in this field. This is one thing. Another thing is we have quite a long waiting time in Germany. We wait for weeks in some special parts of the medicine. For example, if you need a computer tomography or something like that on an MRI, you wait for weeks. And here you can, for example, use AI as a gatekeeping system where you, on the one hand, get a smart appointment from your home, and on the other hand, you can use telemedicine and get an early appointment. That's the second part. And the third part is there are a lot of people in Germany, especially the younger people, they want a so-called asynchronous communication. They don't want to drive with a car to a doctor's house, wait there and talk to them vis-a-vis. They want just use an AI chatbot, for example, where they put in their information and wants to get the information the same way, asynchronous, in an asynchronous way. And for example, health insurance, SHI, etc., health insurance companies, they will profit, they will use this for their communication. Today, they have big call centers where they call the insured people, and tomorrow they will use these chatbots and video avatars and AI solutions.
So pretty much healthcare on demand. It's one of the biggest trends we can observe in the field, like coming from different other areas of the market out of healthcare. This kind of consumerism, of healthcare.
Yes, and I was a few weeks or month ago, I was in Warsaw at Deloitte, and they also prepared a study where also this demanding fields in medicine, they had a big study in Poland. So I think that's the way. There's a consumerism, there's a statutory health market, and both. We have both, but the private market will will enlarge in the next years. A lot of people want to pay for health if it's convenience, for example, if it's faster, more convenient. And my students, for example, they want to pay for it when it's faster.
I see. And you mentioned the other thing that is bringing my next question. So as we witness this rapid advancement of technology, of AI in healthcare, there is this ethical considerations and patient privacy become increasingly important. And how do you think in Germany is addressing these ethical concerns and ensuring the protection of patient data in the context of AI applications in healthcare? And are there any specific policies or initiatives that you find particularly promising in safeguarding these aspects?
Yeah, we have a lot of laws. If you can imagine, Germany, we are experts in having laws. So we have now a lot of new laws coming out, and I think the data privacy and data security, both fields, are very on a very high level. That's on the one hand is a kind of challenge, because everything must be 100% safe in Germany to use it. And in the global competition, it's a big problem, because we have all the GDPR in Europe, but in Germany we have the highest level of living that. So that's one of the challenges in the future, how we can deal with it, because there is no 100% safety in the digital field. We must know it, that data can always be hacked, data can always be or data will get to another hands when, for example, a startup will be sold to another company. So like we have it with My Sugar, for example, in the past, or other apps. So there is a challenge concerning data privacy and data security, but I think that's the normal way. The new standard is everything is safe and everything is the standard is quite safe, not 100%, but quite safe. But we must focus on the solutions and not on the problems, because then we don't have to start.
That's true, and also all the policies and laws might lower the speed of advancements in healthcare. That would not be beneficial to patients at the end. And my last question to you: what is the recent most significant trend for healthcare providers in Germany when it comes to digitalization? What can you observe, or what did you hear?
Yeah, to my mind, I'm talking a lot with startups, healthcare startups, with SHI, with doctors, with different players in the healthcare field. And to my mind, there is one big trend, and is to see more prevention-based medicine. We also have here a term which is called P4 medicine. It's personalized, preventive, and in this field there is a lot of things to do, and we can have in the future we have more data to also measure prevention. It's on one hand. On the other hand, I think longevity is a very interesting field, because a lot of people wants to get older, and not only older but also healthy older. And you have more market fields in the future. Prevention, which starts in early age, and to the older age in the longevity part. So I think this is one big trend. Another trend is, I call it the third healthcare market. The third healthcare market is data versus data versus you get something for your data, not for your money. It's like the share economy thoughts. So you share your data and you get something from the medicine part. For example, you share your tracker data, how many kilometers you make per day, and then in the future your health insurance is you get some money from health insurance, or even get some appointments or some stuff. And I think it's also an interesting part, because it's not about data security, it's more about sharing data in the future and using this data for more research on the one hand, and for personal benefits on the other hand.
Great. That's super interesting, especially the part about data sharing and how it will benefit patients and providers and payers at the end. Thank you so much. And it's a wrap. It's the end. It's the end of the episode for today. David, thank you again so much for joining us, and have a lovely rest of the week.
Thank you very much for having me.